Hi, folks, and welcome to the Cronin Agency. I thank you very much for clicking on this video so that I can hopefully be of some help to you in navigating Medicare.gov so that you can sign up for a Medicare prescription drug plan. So, first off, here, if you can see my screen, you can see up on top, you'll see Medicare.gov. So you want to type in your browser. I'd recommend doing it from a computer where you have a bigger screen. If you have to do it from your phone, you can. But you're going to type in Medicare.gov or www.medicare.gov. Once you get to this page, and I do want to remind you that different times of year can make this page look differently. They will have it presented differently depending on the time of year, open enrollment, general enrollment. But basically, when you get to Medicare.gov, what you're looking for here, when you're looking for prescription drug plan information, you could click on Get Started with Medicare, or you could click on Find Plans Now. If we scroll down, sometimes they'll have something specifically for prescription drug information, but it doesn't look like they have that on this page right now. So we'll click on Find Plans Now. And you'll come to this next page. It says explore your Medicare coverage options. Obviously, you don't need to explore anything with Part A or Part B or Part C. What we're looking at today is Medicare Part D, as in Medicare prescription drug plans. And what I'm going to do is put in a New Hampshire zip code. We'll go with a Portsmouth, New Hampshire zip code 03801. You're going to be putting in your zip code, of course, and you're going to click continue. Then it's going to ask me, what type of plan am I looking for? Medicare drug plan, Part D. Find plans. Now it's going to ask me some information here, which doesn't apply to most people. As a rule of thumb, unless you have one of these situations that we've talked about, click on I don't get help from any of these programs and click continue. It says, do you want to see your drug costs when you compare plans? Yes, of course, we want to see that. Unless you have no prescriptions that you're filling on a regular basis, then click no. But do we want to see? Yes, click next. Now let's see, I'm going to put in a couple example medications of some popular medications that I see come across my table. We'll go with lisinopril for blood pressure. And you're going to select, once that's in there, you'll see, okay, is that the correct dosage? I apologize because I skipped over that rather quickly. But when you bring up the medication, it's going to give you every dosage available, and you put in your quantity. I'd recommend I'd recommend just keeping it at every month. If you fill every 90 days, that's fine. Just put in the quantity that you need per month. Now we're going to click add another drug. So let's see here. Let's add something that comes up a lot. Eliquis. Add drug. Dosage 2.5 or 5. Well, let's select the 5. You'll find that the system will automatically default to the most popular prescribed dosage, but you still want to check it because that may not be your dosage. They also have quantity as 60 every month because most people take this medication twice a day. Add to my drug list. Okay, let's add another drug. Let's try an inhaler. Let's see here. Spiriva. Now, this is a great example. This asks, Your drug has a generic. Spiriva comes in a generic version called tiotropium, which may cost less. Would you like to add triotropium to the drug list instead? For our sake of the training video here, let's go ahead and say keep brand name, and we'll come back to that. Again, you select your dosage, frequency, add to my drug list. Okay, let's say this is all we have going on right now. We're going to click Done Adding Drugs. And I'd recommend if you're looking for yourself and a spouse, you want to do this separately 2 times. Don't combine all your medications under one because that's going to not give you the correct outcome, based on deductibles and different medications, so do it twice separately. Done adding drugs. Now we're gonna let's see, what pharmacies do we have? We'll change the range. Let's say over 10 miles. We have 29 pharmacies within 10 miles of Portsmouth. They allow us to select 4. So let's say we're interested in mail order. Let's say CVS is one we use. We know Walmart can be awfully inexpensive, so sometimes that's a good choice just to see how it comes up. And let's see if there's a Hannaford in here because they tend to have pretty good prescription drug prices. And let's see if it'll let me select another one. We'll select a Rite Aid. Now we're gonna go over here. We're gonna click Done. And this is where you see what the system is going to do for you. It's going to lay everything out in order of which plan is your truest and best value, meaning based on the monthly premium that you pay, any deductibles that you pay, and any co-pays that you pay for your medication throughout the year. This example that I listed for you is telling me the best price is or the best plan is this AARP, Medicare RX Preferred from United Healthcare. PDP just means prescription drug plan. Okay. Now, this page will almost always default to the prescription drug plans. If you're watching this video, you're not signing up for a Medicare Advantage plan, because otherwise we were taking care of this portion of this for you on a Medicare Advantage plan. So see up on this right-hand corner, it says view 27 available Medicare Advantage plans. You don't need to view those, because if you're watching this video, you're likely signing up or have signed up for a Medicare supplement plan with me, and you need a standalone prescription drug plan. So this is what we're looking at. Anyway, what I want to show you here is this is showing you right now, it says 10 out of 14 plans. So it's showing me 14 different plans. So it's showing me this AARP plan is the best price, or the best value, I should say. So it's telling me if I had to fill those 3 medications every month for the rest of the year at the retail pharmacy, it would cost me my total cost between my premium, my any deductibles, and any copays, it would cost me $1,572.84 per year. If I go to this next one, Humana, they're at $2,000 for the year. So obviously you're going to pay more with that plan. Humana Premier, paying a little bit more. Anthem, you're paying more. This other Humana plan, paying more. So it's a rare circumstance where you're going to select a plan where you're paying more. I won't say there's never a circumstance, but it's a rare circumstance. So when you get to this point here, what you're going to do is click on Not Enroll Yet, because you want to look at the details. You're going to click on Plan Details. You can see the name of your plan up here, plan type, drug plan Part D. It shows you your monthly premium for this plan. This means they will this 105.30, that is what you'll have to pay every month. Now, if you take Social Security, you can set that to come up directly out of your Social Security. If you don't, you can select a paper bill, or you can a lot of times set up an electronic payment out of your checking account. So let's scroll down here. You're going to see this plan is 105.30 per month, but there's no drug deductible. Okay, so that's one of the benefits. This is looking like a good plan with those medications we picked, because a couple of those medications are higher tier medications, which require you in most cases to clear a deductible. And this plan has no deductible. It has a bigger premium for sure, but no deductible. So you're going to scroll down here. It's going to show you the medications we listed: Eliquis, lisinopril, Spiriva. If any of that's incorrect, you can go back on the platform, back to search results, and keep going back, fix those, and then come back to this page. Another thing to look at here is it's going to show you which pharmacies are preferred. So for this plan, Hannaford is preferred, Walmart is preferred, and mail order is preferred. Now this tells you if you were going to fill at Hannaford for the rest of the year, your total out-of-pocket expense to fill Eliquis for the rest of the year comes out to $282. Your total out-of-pocket cost to fill lisinopril for the year is $34.37. To fill Spiriva for the rest of the year, $322.73. Now, again, those are not monthly co-payments for the meds. They are adding up your out-of-pocket to fill those meds for the rest of the year. So in order to fill Eliquis for the entire rest of the year, through the end of the year, would be $282 in co-pays for you. Okay. And as you scroll down here, you'll see what they're estimating as your monthly drug cost. Okay. So we know that your total premium and the total cost to fill your medications, in other words, co-pays, so your total out of pocket for the year, based on the medicines that we have here, it would cost you $1,586.80. That includes that $105 premium that you're paying every month, and the estimated $98.91 of co-pays each month to fill those 3 medications. Now you'll notice what happens here: 98, 98, 98, 98, 98 in August, 98 in September, 45 in October, nothing in November, nothing in December. Okay, that's because there is no longer a donut hole in Medicare, and at that point, you've hit what they call the catastrophic out-of-pocket limit. Okay, so you've reached the limit as far as how much you'll have to pay out of pocket. After that point, you will not pay anything for any prescription drugs, even new prescription drugs. Okay? Hopefully that gives you a good understanding of how to read the plan. And then once you've done that, you'll go over and you'll click Enroll. It'll say you're joining AARP Medicare RX Preferred from UHC PDP. That means Prescription Drug Plan. You're going to click on Join Plan. When you get into this part of the application, it's very, very important to know what we call what open enrollment period or special enrollment period are you in, okay? Are you new to Medicare? Completely new, turning 65? Are you new to Medicare, but you were notified about getting Medicare after your Part A and Part B coverage started? That's kind of a rare circumstance. You had Medicare before, but you're now turning 65. That would be for someone who is disabled and had Medicare. Now they're turning 65 and they have a new enrollment period. Are we part of what we call the Medicare Advantage open enrollment period, which we're actually in as I'm recording this between January 1st and March 31st of every year is what they call the Medicare Advantage open enrollment period. That's when you can switch between Medicare Advantage plans, or you can switch from Medicare Advantage, if you're on a Medicare Advantage plan, back to regular Medicare with a supplement and a prescription drug plan. That's probably not your case. Then there's some different circumstances, such as maybe you changed your address. Not if you're in the same town, that would not necessarily be something to worry about. But with Medicare prescription drug plans, if you change a county and even in your own state, that can sometimes affect your plan. So that could be a reason for what they call a special enrollment period. There's also other enrollment periods. I'll show you one or two of the more popular ones. Let's find it here. And a very popular reason for moving your coverage over is I left my employer coverage or union coverage, now including COBRA coverage that used to not qualify, but it does. I left coverage for my employer or union. You'd select that. That's popular. So the three most popular reasons or enrollment periods that you'll be checking, that people will be checking, will be you've turned 65 or you will be turning 65 in the next 3 months, or you have turned 65 in the last 3 months. You've enrolled for Medicare Part B to be active in the next 3 months, or it was active for you in the last couple months, or you've left employer coverage and that's ending whenever that may be for you, and then that's a reason for what Medicare calls a special enrollment period. Once you fill that out, you'll click next, and I can't really go any farther with you through the application process. But once you get into that part of it, it's pretty much just answering questions, putting in your data. Make sure you have your Medicare ID card with you, perhaps a checkbook, and that you're taking good notes. It's probably going to ask you for an email address as well. And I hope this video has been helpful. The reason we put together this video is because due to changes in the Medicare system, um, prior to 2025, we used to help navigate all of this and pretty much take this burden off of people that we were working with, clients. But rules were changed from 2024 to 2025, and this is basically our way of trying to help you best that we can, give you some guidance, um, but we can no longer directly help you enroll in these plans like we used to. So, anyway, I hope this has been helpful. Have a great rest of your day, and we appreciate you working with the Cronin Agency. Bye-bye.